So as they said, my name is Luke Small. I'm actually a third-generation optometrist, and a lot of people who are here today who have no connections to optometry kind of go, oh, well, there's your reason for doing what you're doing. So I grew up in St. Patel. We ended up in immersion. I graduated from Jean Sauvé way back in 1991. Ended up then on a swimming scholarship at TCU in Fort Worth, Texas. Ended up with a degree in environmental science, and obviously with my dad as an optometrist, I kept coming back home in the summers, working for him and working for in the different sort of areas of the job. Attempted to get into quite a few schools. My first round actually didn't get in, to the chagrin of my dad and my grandfather the first time. Eventually on my second try, after doing a 5th year at TCU after I'd graduated, I was able to get into Cal Berkeley. So the University of California, Berkeley has an optometry program there. Graduated from there in 2000, where I met my wife, who is from Santa Barbara, California, and now living in Winnipeg, so you can imagine how that goes. We both practiced together. We came back in 2000, worked here for 2 years, and then we actually moved back to Santa Barbara. We left Winnipeg, thought this is a good time to do it, sold our house, moved there, and in 5 years working there, I worked in 11 different practices. Completely different setup down there compared to in Winnipeg, and I'll get into that. Then in 2007, my dad was looking at retiring, selling the practice. The person that was about to buy it had actually fell through. And so my wife and I said, well, if we're going to do this at any point, let's do it now. So we've now been back almost 7 years. Worked with my dad for a year, and then he retired. We've been at the same practice since December 1979. But the practice actually was started by Frank Armstrong in 1960. And so we're almost at 100 years of having the same practice going. So that gives, hopefully, me a little bit different perspective and having long-term eye care. We have some patients in our practice that we've almost been seeing for 70 years. So that's some of these 90-year-old people that I have in the practice. So it's a long time. I'm involved in the association with our PR campaign. So Dr. Mark Gilman, who spoke yesterday, I sit on the PR with him. So we're actively involved in promoting our profession, and that's why we get to do things like this. I'm also involved with the CNIB, so I'm a rep with our association. So that's the Canadian National Institute for the Blind that happens to be just down a block or two from our practice. And I also sit on a national programs and service committee with them. So lots of stuff, very busy. We also, a couple of years ago, were able to set up a practice for the first time at Siloam Mission. And we think that's the first optometric eye care practice or within a health center in a homeless shelter in Canada. So kind of some interesting things that you can get involved with and change up your routine. I think what I'll do is I'm going to let Leanne kind of explain why I brought her along. She's currently at the University of Waterloo. She's in her 4th year. She's about a month. I keep saying that she's a doctor minus a month, so she's about a month away from graduating. In your 4th year, you do what we call rotations or internships, and you do those all over the place. For instance, for myself, I ended up doing one in Orlando, did one at an Air Force base in California, and also did one in Beijing, China. So you have lots of different opportunities to do different practices, and usually for about a 3-month stint. So she'll be with me for a month, and she also partnered with a couple other big practices in town. So she'll be able to give us a better perspective and give her some background as well. Once she's introduced herself, then we'll go through the slides. This is totally casual. I remember being in grade 11 and 12, and I would sit there and kind of hide and not say anything. So definitely, if you're shy and would rather not say anything and rather talk to us after, we'll be here. Come talk to us. We're very open, very interested in helping people help you choose your career path, whether that's optometry or not. We're here to let you know exactly what to expect. And what your day-to-day activities like. Also, as I mentioned to Leanne, that shadowing is a really, really good thing. So what that means is that you can come into our practice, or you can talk to your own optometrist, and a lot of times, especially anyway for me, and even with my wife and my associate, that we have lots of high school kids that come in and shadow. And I think that's really key, because you've got to see what this day-to-day stuff is like. So I'll let Leanne talk a little bit about her background, and then we'll be going back and forth. But please, if you guys have questions during this, the slides are really just open for discussion so that it kind of brings in stuff. A lot of it at the start is explaining what we do and the science behind it. Then we can get into school, and that's where Leanne can, because definitely things have changed in the last 15 years since I graduated too. So Leanne?
Thank you. So let me look My name's Leanne, as Luke said. I'm in my 4th year of optometry at the University of Waterloo. Background about myself, I'm 25 years old. I'm from Winnipeg, born and raised. I did my undergrad in biochemistry at the University of Winnipeg. I took advantage of the 3-year science degree. Out of high school, I was thinking, okay, I hate English, I like science, let's go the science route. So then you enter your world of university. I went to a small high school, the Gray Academy. I graduated with 35 people in my class, so U of M was a little intimidating with the amount of people. So I went to U of W, and the advantage was small labs. I was in the old U of W campus. We did our labs in the basement. Our lockers were very dingy, and now with this amazing campus, I think the education has even blossomed even more. So I think that's really cool. Choosing our classes for sciences, that's a big cloud over your head because you're like, where do I start? What do I do? So at the point when I started sciences, I was unsure. Optometry, dentistry, medicine. I kind of wanted to keep my options open, as I'm sure many of you guys feel. And it actually wasn't until my 2nd year university where I made that decision I wanted to go into optometry. I did a lot of volunteering through high school and university. To name a few, I was at the Children's Hospital. I got to be in pediatrics in the ward, and my favorite, I love being around people, I love being around kids, so I'd go be in the ICU unit and holding these small babies, and that was really great for me. But then I had to think about, what do I want to do with my life? Like, do I see myself working in a hospital environment? Do I see myself in an office? Do I see myself at a desk? I'm a very people person, and I always dreamed of having this doctor-patient relationship. I'd go to my family doctor, and they know me over time, and you switch from your pediatrician to your female family doctor in my case, and it was a big step, but I wanted to grow with somebody. And so my optometrist said, hey, why don't you come into our office? We have a new female associate. So I started shadowing a female. In my opinion, it was good to see what a woman does, how that works, and what their lifestyle is like. And I got my doctor-patient relationship that I always wanted, and healthcare. Optometry is a very advancing field. From when I started 4 years ago to today, there's new advances, new technology, and it's so cool to be part of that and say, yeah, that's regular, that's normal. As Luke would be like, oh, we were learning that 10 years ago as factor X, and now when I learned it in school, we know that what the drug name is actually called and how it works. So things are always evolving over time, and it was important for me to pick a career that I could move along with. So yeah, 3 years, I did a full course load at U of W, and then I actually took a year off, and I traveled and worked a little bit. I figured I gotta get some freedom out there, and then I applied to University of Waterloo and ICO in Chicago. I interviewed at both, and both very different interview processes, which I can talk about, and I was accepted at both, but I chose to go to school in Canada, close to home kind of, and it was just a great program. I could really see myself at that school. The optometry program itself, it's very demanding, but it's very rewarding. Your first year, you kind of step into a world of sciences, and as you move along, you learn how the eye is related to the whole body. The coolest part is my last year, which I'm in right now. I've done 3 4-month internships. At the University of Waterloo, we have about 8 different clinics focusing on pediatrics, geriatrics, binocular vision, all different cool things. Then I was down in Mobile, Alabama. I'm sure many of you haven't even heard of it because I hadn't heard of it before. But I worked with some ophthalmologists, which are the surgeons, and that was really cool because I could see their scope of practice, but I learned so much. And then in July 2013, Manitoba, the last province in Canada, passed the TPA Act, which is therapeutics. So now optometrists all across Canada can prescribe medicine for eye problems. If you come in with pink eye, or now more diseases like macular degeneration and glaucoma, which is huge. Along with that act, passed the ability for students to intern in optometrist office legally, so that brought me back home to Winnipeg gladly. I've had some great experiences across the city, especially at Luke's office. I'm learning a lot. I get to see my own patients all day. Luke will come in at the end because he's been seeing these patients for over 70 years, like he said, well, not himself, but the generations over time. So it's so unique to watch that relationship build over time and get to practice my skills. Also, I've had the opportunity to still be involved with ophthalmology in the city, meeting the ophthalmologists and seeing what they do. I volunteered with CNIB throughout optometry school, and I went on, during school, there's a lot of great opportunities. I went on a VOSH mission, which is a volunteer opportunity for humanity, and I went to Ecuador, and we set up eye clinics there, and we saw over 1,000 patients in 3 days, doing basic eye exams, referring them for surgeries, and giving them glasses. So it's been a very rewarding experience, and I'm excited to be back in Winnipeg and practicing here.
So as you can see, we can kind of give you, taller, two different perspectives on where optometry, how we got involved and how people get involved. I think what we'll do is we'll kind of roll through some of the slides. One of the things that a lot of people ask the question is the 3 O's. And the 3 O's are opticians, optometrists, and ophthalmologists, and where we fall and how we all sort of intermingle and how we work together. So an optician is someone who actually fills a glasses prescription. They are the glasses experts. I have 2 opticians in my practice who work for me, but they could also be at lens crafters, they could be at Hakeem, they could be in a lot of those different places. Some of them even have their own independent practices. They're not diagnosing by any means, so they're not necessarily saying that you have this type of eye disease or that type of eye disease. They do fit contact lenses. I work very closely with a lot of great contact lens fitters who are opticians. We also do that within our practice as well, but going back and forth. On the ophthalmology side of things, there you've got someone who went to their 4 years of med, then went on and decided to specialize in the eyes. And they can even specialize further, that they specialize in a specific part of the eye. So they're, at least in Manitoba, they're generally surgeons. So they're the ones that are doing cataract surgery, they're the ones that are doing glaucoma surgery. So we call that almost secondary or tertiary care. Optometry, we fall in the middle. So we're the ones that are diagnosing, that are providing you with your glasses prescription, that is saying this is where you're at. We can treat up to now, but now we think you need a surgical referral. So I kind of look at us, I often call myself the quarterback, and sort of letting that patient know that we're here for them and that we will send them off to different consults when need be, whether that's with an optician or whether that's with an ophthalmologist. Do you want to click to the next slide? So you can see this kind of basically tells what we're dealing with. I would say one of the biggest things that changed from my dad's experience to my experience is just how much systemic factors play a role. And what I mean by that, if someone has high blood pressure, if someone is diabetic, if someone has a thyroid disease, just how much prior in my dad's career and especially in my grandfather's career, that wasn't even, barely even discussed. Now it's a crucial part of what we do. We're constantly dealing with that health history. So if you jump to the next slide. Yeah, so this is some of the things, what does an optometrist do? Examine people's eyes to diagnose vision problems and refractive errors. If you just go back. These pictures always, I don't know if you can go back. Yeah, so this instrument here, which you guys are probably all familiar with, is called a phoropter. The phoropter, in terms of what we do daily, that thing becomes a big part of what we do. In terms of repetition, saying better 1 or 2, I've probably said it 1,000,000 times in my life now. So that can get a little repetitive at times. Leanne and I were just talking, and I think in her career, what she'll probably see is that there's probably an instrument that will do this better than we can. I see that on the horizon, so that will change, I would see, potentially even the next 10 years. If you jump to the next one. So we also get into visual acuity, which is how you see, your depth perception, your color perception, how you see things. Right now, I've got the city of Winnipeg is sending me quite a few police recruits. Obviously, when you're talking about police, ambulance, fire, they have to pass their color vision tests. We don't even worry about women with color vision. A woman having a color vision problem is like getting struck by lightning, bitten by a shark. Very rare. In terms of men, it can happen a lot. And with those particular professions, you've got to be able to pass that test. So I often get asked for second opinions on that. So examining people's eyes to diagnose eye diseases such as glaucoma and cataracts. So we do see probably just about every day I've got glaucoma patients and cataract patients. So assess the eyes for signs of systemic diseases such as diabetes, high blood pressure, and thyroid disease. So I work pretty closely with the Canadian Diabetic Association and do quite a bit of education to these diabetic patients. Diabetes there's some days that I almost feel like all my patients are diabetic, but I've had days, I probably see on average anywhere from 15 to 20 patients per day. And it's probably about every 20 minutes that I'm going through and meeting with people. and especially just for anybody who is interested in this career. I might be jumping ahead here, but people is what it's all about. And there are absolutely days that I want to go hide in a cubicle and not talk to anybody, but I can't do that. You're on stage every day. And if you've got something going on at home, something that's going wrong, the dog pooped on the rug, something that happened that morning, you can't let that show through. And so you're constantly, I shouldn't say that it's acting, but you're promoting, and you've got to, you're their healthcare provider. Now, having said that, I've definitely worked with people, even in my own class. Leanne would tell you the same. That necessarily isn't us. I think we're fairly both gregarious people who talk a lot. But there are those shy people that absolutely break through. My wife, who I think is one of the best optometrists around, she was definitely a very shy person. It took her a while to kind of go, okay, am I ready to do this? She works 1 day a week. And I always figure if you're moving from Santa Barbara, California to Winnipeg, you get to work as much as you want. But that also is optometry. And I see a lot of women here today. And if you look back to the classroom pictures of my grandpa, there was one woman. You look at my dad's class, there was one woman. In my class, it was probably almost 65% to 70% women. How many?
70% women as well.
Yeah, and that's, I think one of the major things for that is when you're looking at having a family and sort of balancing that career path, you can definitely do optometry 2 to 3 days a week fairly easy and also earn a fairly good income. So I think that's one of the reasons why it's attractive for a lot of women. So for my particular position in my practice, I would say a ton of my patients are over 65. With our population aging, that's going to happen. My wife probably sees more kids. My associate definitely sees more kids. But you can jump from seeing a 3-year-old to a 93-year-old. So you constantly have to be going back and forth on that. Pre and post-op care, we do that all the time. So if you send off a patient for cataracts, they've had surgery, you're generally going to be seeing them a week later. Usually the surgeon sees them at 24 hours. And then, we're going to be seeing them 6 weeks after that as well. So always analyzing, looking at the test results. So what's really nice for me right now is that Leanne's seeing most of my patients, so I can come in and everything is done. So within optometry, we're still capturing a lot of our own info, which means that when you come into this eye exam, I'm trying to use my staff more and more to capture that info. If you look at surgeons, generally when you see a surgeon, everything that needs to be done is done for them already. And I think as optometry moves forward, we're going to have more and more that technicians will be doing a lot of the information capturing, and then we're going to be coming in, analyzing numbers, analyzing the results, analyzing pictures, and going that way. So contacts and glasses, still a great big part of our practice. A lot of people in this industry, there's lots of opportunities corporately, which means that you could go and get a job at ProVision, you could get a job at Hakeem, you could get those kind of jobs. Generally in that sense, it's a little bit different because you're not as concerned about the glasses or even potentially the contact lens side of things. In my practice, it's about 50-50. So my income is derived about 50% from the procedures that I do and 50% on the glasses sales. Now, compared to my dad and my grandfather's years, where just about every patient they didn't have a choice. They all bought their glasses from the optometrist. Well, that's changing. As you guys all know, you can buy them online, you can buy them at different places. So we've really had to kind of position ourselves as kind of we're definitely a higher end, but I won't say necessarily expensive. We're going to try and give you the best quality. So there is that doctor-patient relationship that sometimes gets difficult. You don't want to say, ma'am, you have glaucoma, but by the way, we have a 2-for-1 sale on our frames. There's that fine line, and that's really where I use my staff to kind of help work with that, and that's where you got to work closely with your staff. We also get into low vision. So we do have some optometrists that provide low vision care. Generally, that's a subspecialty. Because I'm the low vision CNIB rep in Manitoba, I think there's out of 140 optometrists in Manitoba, I just looked at the list of people who say they do low vision, and it's quite high. I think there was at least 60 people on there. But for those who truly provide low vision services, I don't know that there's many. And when you're trying to differentiate yourself within the optometric community, doing things like low vision can be a big asset. So minor procedures, prescribed drugs to treat some. So if you get a little piece of something in your eye, if it needs to be removed, depending on the location, we can definitely do that. And then obviously, as Leanna mentioned, we can also prescribe medications to deal with that afterwards. Some vision therapy and low vision rehabilitation. So a lot of times when we will be working with kids, as I say, this little guy who's got a patch on, obviously that's trying to strengthen that other eye. We still do that. There's definitely a whole other subspecialty of that as well. So we work really closely with ophthalmology, so with surgeons, and then also, as I say, on the other side with opticians. Because we all step on each other's toes, because we all want to do a little bit of what everybody else is doing, I think communication is huge. And that's why I'm trying to get Leanne to meet some of these people, because if you have them on a first name basis, it really makes a big difference. So education. I think basically what we do all day is educate. We're telling you about your prescription, we're telling you about the health of your eyes, we're telling you about certain eye diseases, or potentially telling you about eye diseases that grandma has, right? So then what are my risk factors? What are the chances that I get this disease? So education is really key. So this talks a little bit about where we work. So you've got, we work in private practice, like myself, sometimes by yourself or in a group. I prefer to work in a group because a lot of times, as Leanne and I will tell you, that you're always bouncing ideas off each other. You're trying to figure out, okay, I've got this really weird case, and to be able to talk to someone about it is huge. Some pursue careers in research, teaching universities. I definitely have friends that work in private practice, but then they teach 2 days a week, depending on where they're at. One of my buddies is a clinical advisor at Berkeley still, and he loves that part of it, and getting to teach, and that's one of the reasons why when Leanne asked me to help her out, I enjoy it as well. I think we learn when we're doing that. So lots of science, obviously, but I can tell you that in my class, we had 2 people with English degrees. So, you know, I don't think you want to pigeonhole yourself too much. You've got to look at your prereqs, and I'll let Leanne talk a little bit more about that, because you have to meet your prerequisites. By the time you've met your prerequisites, you almost have a degree. In my class, we only had 1 person that didn't have a degree. So most of the time, you're almost into the degree. Back when my dad went, I mean, he graduated from Kelvin High School, hopped on the train, and went right into University of Toronto, which is now University of Waterloo. So when he graduated, he was 22 years old. When I graduated, I was 27. He figured on his own, he'd maybe seen 10 to 20 patients. I'd seen 2,000. So completely, he said he was nervous for the first 10 years of working. So it's a totally different, you know, you're older and you've got a lot more experience. So essential skills, the ability to keep up to date with scientific and technological development. So we have continuing education hours that we have to do. So unfortunately, education is endless and it keeps going. Manual dexterity, obviously, when we're repeating what we're doing as we're capturing different things with people, that's really important. So you are doing some things over and over. And obviously, strong interpersonal skills. And I'll tell you, not only necessarily with your patients, staffing. Staffing is huge. And if you're going to be in a private practice, no matter what you do, staffing and trying to make that staff work. You know, I'm lucky enough that I get to talk to my dad about staffing. Leanne's dad's a dentist. That skill and how to do that and how to manage that properly or hire the right people to manage it, that takes up a big chunk of your time. The other part is we also own the building. We have a small building that we own on Portage Avenue. I'm also the building manager. So when we got a leak in the basement, guess who's dealing with that? So sometimes I'm running down between patients and emptying buckets. So I mean, that's what you got to do as a small business owner. So this talks a little bit about what you need. Maybe I'll have Leanne talk a little bit more exactly what you're looking for. But what I can tell you is, you know, as you're moving forward, I think if you've got something that you're really interested in that doesn't necessarily follow those prereqs, I would say to go after that passion. Because if you enjoy the classes that you're in, it makes a huge difference. I took a ton of classes I didn't like and probably didn't do so well in them. And the ones that I did like I was probably more English than I was science. So my non-science GPA was way higher than my science GPA. So if you've got that passion, you can always go back and get your prereqs. You know, she went right through 3 years and then 4 years and did it in 7. I did 9 and then my wife did 10. So there's a long time to sort of decide where you want to go. Don't necessarily keep those blinders on. Even if you're looking at med, I think if you can show a medical school or if you can show any healthcare profession that you have interest in other things, it's a huge bonus for you. So I'll let Leanne talk about prereqs.
So across Canada and the US at the optometry schools, the prerequisites are the same. So that makes life easy when choosing university courses that you know if you're completing them, you're going to be able to apply to lots of schools. Getting into optometry is very competitive, I have to be honest. There's 90 spots in the program at the University of Waterloo, about 40 spots at the University in Montreal, which is only French speaking. And then across the US, it varies. In Chicago, I think they take 160 students per year, but in Berkeley, how many were you at? 70. So it really varies. There's about 22 schools in the US, so your options are there. Back to prerequisite courses. I know for sure, I have to jog my memory, you need an anatomy and a physiology course, intro biology, organic chemistry, biochemistry, calculus, and a whole slew of others. Your GPA is part of the application, so keeping that high, 3 to 4 is what they usually accept, as well as when you're getting into school, you have to write an exam called the OAT, similar to the MCAT, focuses on science, reading comprehension, and mathematics. It is a challenging exam, but that's what sets you apart from your competitors. So I can definitely talk to you guys more personally if you have questions about prerequisites and go over that for you.
I think one thing that, from my perspective, that I can help with optometry a lot of times when you get into interviews, in fact, a lot of schools didn't even used to interview. So then they're just looking at you on paper. Now just about all of them do. Obviously, interviews can be fairly nerve-wracking, but showing those interpersonal skills, that will definitely supersede your grades. And by no means did I have the stupendous grades. You know, I was the guy who had to study like crazy. Nothing, unfortunately, never came easy to me. If you look at, in terms of Berkeley, when I was getting in, it's a very small world. So my much more famous sister, Sammy Jo, she's been to lots of Olympics, she's a hockey goalie. She was actually at Stanford, which is just across the bay, in the Bay Area, and the person who sits on the administrative board who helps people get into Berkeley, well, both schools had a club hockey team. Well, my sister was down there for track, but she was the goalie for the club hockey team, and this woman happened to love women's sports, happened to love Sammy Jo, and look, here's Sammy Jo's brother who's applying, let's put a little red flag. His grades aren't so good, but let's help him out. So I still have to thank my sister for letting me get into Berkeley. But those are those small little things that can help. So I think really, you know, if you feel that maybe I'm not absolute that book smart person, but if you have strong interpersonal skills, if you feel like you're a strong people person, then absolutely this is the job for you. So this kind of shows you what you have to go through. Nowadays, back when I was applying, I had to actually buy a typewriter and fill in my applications with the typewriter. Obviously now it goes to one main system. You fill out all your you do your essays, you put your grades online, and then it goes out to all the schools and you choose which one you want to. Interesting now, most schools ask that you have been shadowed. So I get, once I have people shadow with me, a lot of times they're asking me also for a recommendation. And if you've shadowed with me enough, if it's just been once, pretty hard to throw out a recommendation, but I generally ask you to come back a couple times so I get to know you a little bit better, and then I can do those recommendations for you. Yeah, so, you know, I think being self-employed is huge. You know, you get to decide your own hours. My dad was a big proponent of whatever you do, just be your own boss. If you dig ditches, be the ditch digging boss, because then you get to have at least somewhat decide when you want to work and when you don't. So here she is getting to choose her own hours with her big clock. Obviously, this also provides for family time. One of the things that I make a mistake probably sometimes is getting a little too involved. I think anybody who's a professional should get involved with their professional associations. But my kids are now 6 and 8, and so that opportunity to, whether it's coaching soccer or take them to swimming or whatever it is, I can decide when my workday ends. And that's huge. And that was also the same thing for my dad. And when I was looking at choosing a career, I was looking more at his lifestyle. A lot of times when I got home from school, my dad was home. So that was, you know, pretty rare that dads and moms get to be able to do that. So you get to decide your work schedule. So fairly easy on the body. I don't know that too many people have ever been injured doing optometry. Sometimes with repetitive stuff, I've heard of carpal tunnel and different things like that, but that's really rare. They show the big house. So definitely in Manitoba it can be, you know, one of the things when we were looking at moving back, having lived in California for 5 years, we did buy a house there. And what I can tell you is that being house poor is very difficult. So my wife and I were both working full-time, 2 professionals, and the first year that my daughter was born, we were 20 grand in the hole. So we're kind of looking, going, well, how are we going to make this work? When we moved to Manitoba, well, we got twice the house for a third of the cost. So there's some definite advantages to living in Winnipeg for sure. So I can't see that the demand for eye care is going to go anywhere anytime soon. We've got a lot of people with an aging population that need help seeing. So it kind of shows you roughly where is an employee optometrist. And my associate is probably even higher than that 110. I can tell you that she is. So you can do fairly well in terms of that. Right now, because I'm buying the practice and buying the building, I have to pay myself somewhere closer to that top range, just because we've got to move some money around. So really, as time goes on, your opportunity to increase that income goes up significantly. Yeah, so this is talking to us. If you guys, I'm happy to provide you with my email. You can always shoot me an email and ask questions or come up afterwards. I think getting shadowing is going to be how you're going to decide whether you like this as an opportunity or not. So these are some of the places where you can research this. Obviously, you can just Google any of that, and it'll give you a lot of information. Our own Association of Optometrists also has a great website as well.